Hello, in this PowerPoint presentation, we will be discussing undocumented immigrants and healthcare by Diego Felipe Morales, Jacob Herrera, Haley Haskell, Luis Rosinos, and Simran Gupta. And before we start, we should explain the definition of an undocumented immigrant, just in case there are any misconceptions of what it technically is. According to Kaiser Family Foundation, undocumented immigrants are foreign born individuals residing in the U.S. without authorization.
This is our table of contents. First, we will go over the objectives of this presentation. Next, we will review and go into our topics included. Then we will examine a community-based organization that addresses this issue. We will end with the references used to provide the information throughout the presentation.
Objectives. By the end of our presentation, students will be able to locate 3 health resources for undocumented residents. We'll be able to identify one major difference in health disparities for undocumented immigrants in California versus those in Texas, as well as be able to identify at least 2 restrictions undocumented immigrants face while trying to gain access to quality health care.
The topics we will be discussing in this PowerPoint presentation include restrictions of undocumented immigrants face for getting quality health care, the health resources that help those who are undocumented without being reported for being undocumented. Next is the coverage of chronic diseases compared to acute illnesses. And next is the disparities within California compared to other bordering states. Lastly, we will discuss the repercussions of individuals not receiving care.
According to the National Center for Biotechnology Information, undocumented immigrants are denied access to insurance by law. In order to get insurance, they need to present some form of documentation. This also means that undocumented parents cannot provide health care for documented children. Apart from being unable to afford the preposterous prices placed on healthcare services in the United States, many external factors may affect or limit their access. Some include religious beliefs, lack of transportation, and conflicts at work. A fear of being deported is also very prominent. An inability to communicate their needs due to not being able to speak or understand the dominant language also contributes to being unable to access healthcare services. This system is known as discrimination and therefore causes them an internal feeling of shame or that they feel like a burden. Others have created a negative stigma or a negative stereotype about them, and when coupled with their lack of knowledge of the healthcare system, puts the entire community of undocumented immigrants at a high disadvantage when it comes to their access to healthcare services. These are only some restrictions that undocumented immigrants face for getting quality health care.
Confidential resources for undocumented immigrants serve an important purpose because immigrants are considered to be a vulnerable group in American society. To explain this in further detail, according to a research article released by the Health Affairs Journal, a vulnerable population is a group that is at increased risk for poor physical, psychological, social health, and inadequate access to healthcare options. This can be attributed to social determinants or out of the fear that their status as an undocumented immigrant will be reported and exposed. Some of the determinants for vulnerability include socioeconomic background, immigrant status, language barriers, policy and welfare reform, which typically aren't inclusive of marginalized communities and the stigma associated with these marginalized communities. So how does this information relate to us? Well, first, as students in Long Beach, we are directly impacted by this issue because our school and our city is composed of a large immigrant population. Additionally, as public health students, we can provide our obtained knowledge and resources to have some sort of impact on this matter. According to an immigrant resource article released by the local news source Voice Waves, as of 2016, Long Beach's immigrant population makes up more than a quarter of the total population, This percentage roughly translates to 121,000 people. And of this immigrant population, an estimated 30,000 plus immigrants are still undocumented, leaving thousands of people vulnerable to the repercussions that come along with not having access to healthcare. And to add to the burden of being a part of this vulnerable population, immigrants can't even have access to the services that their tax dollar helps fund. According to the information from the Institute on Taxation and Economic Policy reported by VoiceWaves, undocumented immigrants pay an estimated $3 billion in state and local taxes. This statistic trumps the notion that immigrants are depriving the nation from its public resources and shifts the focus on failing policies that are not inclusive of its contributors. As we proceed further, we will provide specific resources for our immigrant populations.
In this segment, I will be discussing chronic diseases compared to acute illnesses reported by undocumented immigrants. I will start by defining these terms. An acute illness or injury is a disease with an abrupt onset and usually a short course. A chronic illness, however, persists for a long time. Undocumented immigrants who are experiencing an acute illness, like a viral infection or broken bone, are likely to turn to an emergency room for treatment because they are not allowed to turn away anyone. Emergency room workers are also not required to report on patients' immigration status, however, it is still a risk. Chronic illnesses such as cancer, heart disease, and organ failure require hospital visits, which many undocumented immigrants are not comfortable with because they require proof of citizenship and insurance. One survey done in an emergency department showed that undocumented immigrants were far more likely to report their illness if it was a level 2 or 3 out of 4 on a scale of severity. Level 1 and 4 illnesses were only reported by 7% of undocumented patients in this study. This shows that patients are only likely to report an illness if it is serious yet survivable. In conclusion, acute illness of undocumented immigrants are treated far more often, and further policy needs to be established for those with chronic diseases so that these people can get the help that they need.
And in this portion of the presentation, we will be discussing health disparities within California compared to other bordering states. There's a few things we should discuss before we go into this topic. What is a health disparity? Health disparities, according to the Centers of Disease Control, are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Illegal immigrants being the obvious socially disadvantaged population in this presentation. Another thing is the disparities for illegal immigrants in healthcare vary between state to state, so we'll focus on comparing California to only one of the other border states, that state being Texas, because its population is the closest to our population. As well as in a previous slide, the disparities undocumented immigrants faced in California were discussed. In this slide, we will focus on disparities faced in Texas and then go into comparing the two states. Lastly, we will not be discussing anything that has to do with the federal law that every hospital is required to screen and stabilize every patient who seeks emergency care. Both California and Texas show some health disparities that undocumented immigrants face. Those being cultural and social barriers. Within these barriers include language, irregular work schedules, and fear of deportation, as well as some other things. The main disparities within Texas that are not found in California is primary carers receive 1 out of 69 federally qualified health centers, FQHCs, or safety net hospitals. A safety net hospitals, also known as county or public hospitals, have longer wait times. Both care for an uninsured and indigent population, regardless of citizenship, except for FQHCs receive money from the federal government and are equipped to provide both primary and preventive care. Because of a lack of uniform national policy, it requires local health care systems to debate ethical dilemmas. So you might not find the same health care benefits between El Paso and Houston in Texas. As well as it costs more for undocumented immigrants because of advanced stages, since they are generally afraid to go to hospitals for just the smaller things, could be in the first few stages of a very serious disease or injury. and are often uncompensated and inadequately compensated, so they would have to bear most of the pay for these. As well as Texas does not grant undocumented immigrants PRUCOL status. What is PRUCOL? PRUCOL is permanent residence under color of law. This is not mentioned in previous slides, but California does grant undocumented immigrants PRUCOL status. PRUCOL mainly gives them certain health care benefits such as scheduled dialysis.
In this slide, I am going to cover the repercussions of undocumented immigrants who are not receiving health care. According to a study analyzed by healthaffairs.org, the real start of this uninsured immigrants came back in the period between 1999 to 2007, when we saw 1.8 million more uninsured immigrants in the U.S., which contributed to the 27% increase in uninsured Americans overall. Those immigrants were also not given aid and were not eligible for care under the Affordable Care Act of 2010. The effect of uninsurance among this population can be broken down into two categories: health consequences and financial consequences. First, I will discuss the health consequences for uninsured immigrants. The National Immigration Law Center conducted a study that stated uninsured adults are more than 25% more likely to die prematurely than adults with health insurance. This shows that lack of insurance causes a correlation between higher rates of death and lowers rates of preventative care. This brings me to my next point, which is the fact that immigrants avoid care altogether due to uninsurance, or they even prolong it until the condition gets to an unbearable point. Due to the delay of medical care, many conditions undocumented immigrants may contract are diagnosed when it is too late. This brings me to my next point of the diagnosis of patients in the late stages of diseases, cancer, and STDs. Due to this fact, treatment options are less effective and patients die within less time after receiving the diagnosis. Economic repercussions also face undocumented immigrants, as those uninsured do not get the same benefits under the healthcare system. Hospitals charge uninsured immigrants without health insurance undiscounted rates more than 2.5 to 3 times the amounts paid by insurers and Medicaid. The high cost of healthcare can put immigrant families in a difficult situation that can result in housing insecurity, credit card debt, and bankruptcy. Lastly, as a result of deferred medical treatment, the undocumented immigrants who lack insurance miss more time from work when ill or injured and may retire sooner because of their poor health. When absent from work, this population has a loss of earnings, which adds to their economic burden.
Lastly, we'll be talking about our community-based organization, programs, and resources based in LA County. Here we mention immigrant accessible and confidential CBOs that act as helpful resources for our target population in the city of Long Beach. First, our Student Health Center located here on campus. Our health center provides its patients with care for acute conditions, injuries, illnesses, behavioral health resources, counseling, rehabilitation services, and more, most of which are paid for by our tuition, and if there's ever a need to pay, it is at a price set to be affordable by students. This is especially convenient for those students in our target population because it is a valuable and accessible resource. The Student Health Center bases its values around student success, quality care, respect and sensitivity, confidentiality, trust, and the promotion of personal growth and development. Second, we have a Long Beach Immigrant Rights Coalition. They have a grassroots network of CBOs that work towards the development of justified immigrant policies and practices that respect human rights and the dignity of immigrants. They operate under the vision to create a city and state that serves as a model of a county that all of its people, regardless of immigration status, are guaranteed a fulfilling and prosperous political, economic, and social life. Some of the services they offer include ESL classes, legal advice clinics, DACA assistance, and pop-up health clinics for those who cannot access quality health care. And the last CBO we'll be discussing today is a resource for LA County as a whole, My Healthy LA. There are no cost care program for those who live in LA County. It is free for individuals and families who cannot gain access to health care. They offer services that include emergency care, inpatient care, pharmaceuticals, primary care, women's health, rehabilitation services, specialized care, and urgent care. MHLA is in partnership with Los Angeles Department of Health Services, even has an Office of Immigration Affairs, Opportunities for Immigrants, and Resources. This is made possible through the network of over 200 community partners to provide care for those who qualify for this service, which would be the mostly immigrants. And that is the end of our presentation, and these are just our references.